A pretty community-driven project, and has been something we've been working on for almost 5.5 years, I guess. So, oh, thanks. Now I'm unmuted. Okay, so I'm really happy to be here on Treaty 6. I grew up on Treaty 6 in Saskatoon and have been spending a lot of time up here since I was 8 years old. Yeah, so for over 30 years. And so this is like my second home. And I really feel a major responsibility as a professional, but also as an individual to do things that benefit the community, both at home in Saskatoon, but definitely here. And as a vet, of course, some of that revolves around delivering services. But this research project, I think, is something even bigger and more exciting that I can help work on to, help community and animal health and welfare in the area. And I think that the impact of this project hopefully will go beyond the tri-communities also. So what I'm hoping to do today, this evening, is just to summarize for all of you what we've done with this project, who was involved, and kind of how we went about answering our questions, talk to you about what we found and sort of what some of the outcomes have been, and then what some of the actions are that we're hoping to kind of take following the research and kind of as a result of it. So as I said, I'm just one piece of the puzzle here. I'm just the one presenting because I'm the one who gets the academic letters at the end of the day, I guess. But certainly I'm not the only one or even the most important one in this project. So certainly if people have questions along the way, I'm pretty informal. So if there's anything that you want to ask or comments, just if I don't see your hand, then just interrupt me. That's totally fine. I don't have a problem with that at all. So in terms of this project, sort of what happened was that I decided in 2018 that I was going to go to graduate school, and decided that a PhD was a good idea, because if I was going to do something, because faculty wants to get more letters behind your name, I figured that it should be something that would be beneficial to communities. And so one of the ways that we can make change in life is through research. Data often talks to decision makers. And so that's one of the things that I wanted to do, was develop my own skills in terms of conducting research so that I could partner with communities to answer questions that are important to communities themselves. So, and as a veterinarian, my focus generally is animals, but the focus of veterinary medicine really extends beyond that to human health, health of the environment, community health in general. And so that's what I wanted to give myself as part of this process, with those skills. So what I ended up doing was I of course, over the years, after, providing vet services here and things like that, I've developed lots of relationships with people, and so had lots of folks I could shoulder tap and ask to get involved. And so in, I guess, September of 2018, got together with several people, including several folks in this room, and made sure, that people understood that what I wanted to do was a research project to answer some questions that were important to the community and ask people to get involved. So what I was looking for was a group of people who would help guide the research project, but then also people who would get involved in actually conducting the research with me as well. So the folks who ended up being involved are Councillor Annie Ratt, who's not here, she's ill tonight. Brandon, who's doing the photography and the videography and making sure all the tech stuff works well for us, and Genevieve, as well as Kelsey Carlson, who's here, Tara Schneider-Ross, who's a teacher at SMBS, and Lisa Mayotte, and then my supervisor, Tasha Epp, as well as Abby, and Julie Baschuk as well. Herb Eisvister was also involved in the beginning, and he sort of spent a short time with us and then had to step back from the research project, but his contributions were really valuable as well. We were also really lucky to have elders involved in the project, in guiding the project kind of right from the beginning and helping us decide what was important. So Doreen McKenzie, Donna Mackay, John Halkett, and Miles Charles have all been involved at various points throughout, but John has been involved right from moment one. And so that it's been really wonderful to have them included and involved and helping us to figure out how to do this in the best way. So once we put our team together, we started to think about what were the things that we were, that the community was concerned about, that the community members were concerned about. I'm going to see if I can advance this. It's, of course, not going to want to do its job. There we go. So anyway, basically, we were looking at what are the things that people want to know, right? What is the problem here with dogs, and what do people want to know? So we knew that there were ongoing challenges in the tri communities with dog health and dog welfare, and that population control can be a challenge, especially without local animal health services, without a vet locally. And that dog control on a day-to-day basis is challenging because dogs don't stick to community borders. The tri communities is one giant area and they just go where they please, right? And the human behavior aspect of the ways that dogs are managed are, different from person to person, family to family, community to community as well. So what we really wanted to do is figure out, we know that dogs are important and that the dog-human relationship is important here and elsewhere. And so we wanted to make sure that we could find ways to keep dogs and people healthy together, because that's the ultimate goal, right? We want people to have those relationships, but we want those relationships to be healthy. And in order for that to happen, the dogs and the people have to both be healthy. So we also recognize that there are lots of resources locally already that are already working towards improved or good dog health and welfare, and wanted to figure out what was the best way to use those resources and then what else was needed in order to improve the situation and fill some of the gaps. So what we started out with was, this is going to work now. Great. Okay. What we started out with was asking these questions. So we wanted to find out what roles do dogs play in the tri communities? How do people understand human relationships with dogs? And what are the things that make that relationship better or things that make it challenging? And how does the tri communities approach dog health and welfare, dog care and control on a day-to-day basis year round? How are dog population and movement controlled? And then again, what's working and what needs to change? So we were kind of thinking, probably the best way to figure these things out is to get stories from people. So to talk to community members, find out people's perspectives, and then sort out what that means at the end of the day. So that's what we did. And we did interviews with 20 community members, or 20 interviews with about 18 community members, I guess it was. We also had youth do some reflective journals for us. I conducted 9 key informant interviews with people who play particular roles to do with dog control or dog welfare in the community, and then document things like the bylaw, the statistics through Northern Animal Rescue, and then also provincial legislation that's sort of guides the delivery and oversight of animal health and welfare services. So that was all really interesting. And one of the things I said this morning when we were meeting with leadership is, I thought I knew a whole bunch of stuff about dogs and how dogs are managed in the tri communities before we started this project, because I've been, working here for long enough that I figured I knew. And my goodness, it is a complex situation. And again, I think that the complexity is, there are a number of different reasons why it's complex, but I actually think that everywhere this is a complex thing. I think that it's always, because dogs are so emotional for people, we develop these strong relationships. We feel a lot of often identity through our relationships with dogs. And so it can be an emotionally challenging subject talk about, but also to manage on a day-to-day basis. So I think there was a lot of acknowledgement and recognition that that was the case. So after we'd collected all of our data, and a whole bunch of us participated in trying to get to the meaning of what people were saying. So not only, the literal words that people were saying, but also the sort of meaning behind the words, and figure out what kind of patterns we were recognizing. So this was sort of the model that we came up with. Really what this represents is, in the middle, we have the dog-human relationship. And we developed this holistic understanding of that relationship as something that has emotional, physical, social, and spiritual attributes. And when any one of those aspects of the relationship is out of balance, everything's kind of off kilter. So the goal ultimately is to have that relationship be balanced over the short term and the long term. But how do we do that, right? So we figured out, or we sort of discovered with the data from our participants, what were the roles of dogs and the other things about dogs that sort of fit into each one of those 4 parts of the medicine wheel. Once we know that, we can figure out, okay, maybe what we need to do is if we identify that it's the physical relationship or the physical part of the relationship that's a challenge, maybe those are the things that we need to pay more attention to and sort of alter, right? So maybe that's because dogs are roaming and they're causing physical threats to people. So if that's the biggest issue, then that's where we can spend a little bit more energy and potentially at the same time also increase the contributions to the spiritual quadrant or the emotional quadrant, right? How do we regain that balance so that the relationship is healthy at the end of the day? We also recognized that there were things outside of those 4 aspects of the relationship between dogs and humans that play a role too. So those were things like the needs of dogs, but also community needs. And if those are getting met, everything should be pretty hunky-dory in the middle. But if they're not getting met, then we tend to have problems, right? Because if dogs don't have access to food and water or shelter, those types of things, they can't get the exercise they need, then they're not going to be able to bring a healthy self to the relationship with humans. And then we have problems. Similarly, for the community, we heard a lot about the things that are lacking in the tri-communities in general, that if those gaps were filled, we would have better outcomes. So those were things like, we need a designated place for dogs to exercise, off leash and socialize together. So dog parks, right? Somewhere for dogs to get groomed, somewhere for dogs to stay when their owners go out of town. Training, and I recognize that Jamie Woodhouse McKenzie has started to fill some of those gaps with her business, which is wonderful. People were really finding that there's a lack of resources for dog health advice, for first aid, right? When emergencies happen, how do you get those dealt with when there's no local veterinarian? And really recognizing that there's probably a need for non-professional care providers, people who have a certain amount of training who can provide some of that animal health care when there is no vet here. And then there was a lot of talk also about the need for someone to help animals have a good death when they're suffering, when they're injured, things like that, and that's often a difficult thing to access. So those were, some of the things that we heard. Of course, people want to see a veterinarian here or want there to be local veterinary services on an ongoing basis. And the recognition that there needs to be a local animal protection presence. So people who are enforcing the Animal Protection Act and making certain that animal welfare is good. And then a lot of talk about education and training. So in terms of the things we heard the most from people in the community, the need for education was one, and the fact that dogs are family members was the other. Those are the 2 things we heard the most about. And so it was really, really interesting because that was also what Elder John had told us right in the beginning when I went and spoke with him and said, what do we need to do? He said, we need education. We need to figure out a way to help people learn how to have good and healthy relationships with dogs. So that's kind of been our driving force with all of this, and what we've been trying to work towards with the project. So as far as the other elements of the model here, you've got this piece about community and family dog care, and then what we called holistic influences. Basically, what this means is that there are approaches to caring for dogs in the community that are concerning sometimes. So some people have worries about things like uncontrolled breeding. So some people call that backyard breeders, dogs being chained for long periods of time, dogs roaming. And again, like I said this morning, sometimes there's tolerance for a certain level of roaming dogs, right? If they're well behaved and they're socialized and good with people, but there's no way to sort of police that. That's really easy. And so roaming in general is recognized as being a challenge. And then there was a lot of recognition too that when people are unwell, so say people have things like addictions and poverty, things like that, then obviously it's trickier to also care for an animal. And so oftentimes the care of dogs can be challenging there too. So there's a lot of talk about how dog control is approached in the tri communities and the things that are working and the things that are challenging. The biggest message that we got, I think, and talked about this morning with leadership a lot, is that having 3 different approaches to dog control is tricky, because it often means that there are gaps, whether it's hours of service or who does what where. All of those different things. And of course, the different bylaws and different fees for licensing dogs and all of those things can be challenging as well. And then sometimes what it means is that resources, funding, and personnel, people resources are sort of allocated in a way that maybe isn't the most efficient either. So there was a lot of talk about how some of those resources could potentially be shared between the 3 communities. To have a more cohesive tri-community approach. So talked a fair bit about that this morning. We got a lot of information about how many of the gaps are often filled on a day-to-day basis by Northern Animal Rescue, and everybody I think recognizes that NAR is very active in the tri-communities, and that there are things that are amazing and wonderful about that, and NAR also experiences lots of challenges, right, in terms of resources and people and all of those different things. So it's good to know about those things. We also heard that there is an aspect of sort of social dynamics and tensions between people and tensions between the communities that poses a challenge to the ways that dogs are cared for and controlled in the tri communities too. So that was something that needed to be addressed as well. There was quite a lot of talk about laws, and whether that's local bylaws or the provincial or federal laws that can pose barriers to how dogs are cared for or how dog control happens. And then also how those things are enforced and who does that enforcement and how as well. So those were challenges. One of the last things is that we heard a fair amount about that environmental events like the pandemic and the fires in 2015 really affect every aspect of the dog-human relationship and dog care and control. And so that's really something that needs to be considered. And when we think back to the 2015 wildfires, when we again talked about this with leadership this morning, but one of the big, I think, messages or pieces of learning that came out for any of us that were involved in that was that dogs were not consistently sort of returned to their owners. And there were a number of different reasons for that. And some of that was because external organizations were coming in and taking dogs and believing that they would be better off somewhere else, which is problematic in a number of different ways. And there was also at that point in time, really, there were no guidelines out there for how do you manage a situation like that, where you have to evacuate hundreds of animals and thousands of people, right? How do you put them back together at the end? So lots of things that were learned through all of those situations, and COVID pandemic really interrupted our ability to come and provide vet services, for example, right? And folks who are able to go down south had a lot more trouble doing that during the pandemic also. So good to hear that. Finally, things like colonialism and racism as a part of that, and other forms of oppression really play a major role in dog-human relationships and the ways that dogs are cared for and controlled in any community, but certainly here. And so, again, something for us to consider and pay close attention to as things are moving forward and next steps are taken with regards to, any legislation, actions, things like that. So I'm not going to talk a lot about this busy picture, but this is just kind of a different way to represent all of these ideas that came through with our data. So I think about the stuff at the bottom is things like the soil, right? And the sunshine and the water and the wind. And these are all things that affect all aspects of this bigger picture of the dog-human relationship and dog care and control. And so when we have those forces, and those are the things like colonialism and the social tensions and all that sort of stuff, the environmental events, depending on how those things are, that often will influence everything else down the line, right? And it's not a one-directional relationship. The things in the center just as readily affect the stuff on the outside. But there's definitely, there's a lot going on, right? It's a super complex situation. So at the end of the day, for me, one of the biggest things that's important to understand is the complexity, right? That it's not a simple situation, and there are certainly no simple solutions to any of the things that people identify as issues or challenges or problems when it comes to dogs and the dog-human relationship, but that there are a number of things that, now that we understand them a bit better and know that they're there, potentially can be attended to in a more targeted way so that we can have better relationships between dogs and people when it comes to dogs in the tri communities. So as far as, we're not going to go through that. We already talked about those things. All this artwork is from our project that's part of this research as well. So we'll talk about that in a minute. So the things that sort of came out of this at the end of the day, right? What are our conclusions? It's okay. Okay, sweet. Thank you. That's much better now. I don't hear myself twice. So dog-human relationships are kind of based on family, right? We see dogs as relatives regardless of our worldview. So everyone who we talked to in this research project talked about dogs as family. And that was, again, a really important message that came through. And when that relationship is healthy, when that connection between dogs and people is healthy, there are fewer problems observed. We also concluded that an animal rescue assumes a lot of the responsibility for dog control currently here, and that the lack of formal agreements, though there is a formal agreement with the town of Ronge and NAR, but there isn't a cohesive agreement across the board, and there are challenges around having stable or sustainable funding, and that's a problem. And so we heard even from folks who are part of NAR that, doesn't have to be Northern Animal Rescue who does all this work, but they do because they and other folks in the tri communities are trying to fill the gaps, right? They're trying to plug all the holes in the ship with their fingertips and make everything stay together. Animal protection, on the other hand, which is the sort of legal animal welfare stuff. The RCMP are technically the local animal protection officers, but they often are unable or not trained appropriately in order to fill that role in a meaningful way. And so then what ends up happening is NAR, other folks, the dog catcher for the band, end up taking on those roles too, which is challenging in a number of different ways, but certainly can be a legal issue at the end of the day. We also heard, again, bylaw challenges, that there are some things that aren't attainable within the tri communities that are written into the bylaws, and that enforcement, there are many gaps in the enforcement aspect. of it. And part of that is because the socioeconomic status of many residents doesn't allow for enforcement to happen the way that it's written, right? If my dog's roaming and it gets picked up and the fee to get it out of jail is $250 and I don't have $250, I'm not getting my dog back. And so then what have we achieved at the end of the day, right? We've basically disrupted a really important relationship. And then what ends up happening is that dog ends up in the network of where the heck are we going to put this critter now, right? How do we find a spot for this animal? So there are a number of challenges there. And again, community tensions really do increase the issues between dogs and humans and vice versa. Where there are community tensions, dog issues are more of a challenge as well. So those are the big conclusions that we heard. And I think, we talked a lot about the recommendations today, but I think, as far as the general population of the tri-communities goes, knowing about some of these gaps, I think is important, because what it means is that then you can support community leadership in making changes where it's possible. And again, we talked a lot about that this morning, and it sounds like there's a lot of action happening already in terms of looking at bylaw changes and things like that, which is great. And so, none of these things are new or mysteries to our community leaders. And really what we're doing here is just trying to make things a bit more clear so that navigating next steps is easier. So we've heard lots about having a way to permanently identify dogs, whether it's microchipping or whatever it happens to be, and having a system across the board would be really helpful. We need more dog houses. We need more fences for people and ways to access that. We need to get rabies vaccines a little bit, spread further across the community, and vaccines in general. Public health campaigns would be helpful. And then again, having some way to have a cohesive approach between the three communities when it comes to dog care and control is something that people want to see. So again, we've got some of these things in terms of training, equipment, and rabies vaccines for the people who do animal control is really important. Folks want to see policy change. They also want to see a way to support people to stay with their animals. And so understanding that dog pulls happen in the tri-communities and they're necessary in order to protect community and public safety, but that they are not the ultimate goal, and that most folks in the community want to see those phased out when it's possible. And right now, that's sort of the best approach in order to get some of the dangerous ones out of the communities so that people aren't in danger. So again, one of the things we talked about this morning was that dog pulls they're a crisis control measure. They are necessary right now, but that a lot of people experience dog pulls as a traumatic event. And so, the band is currently organizing more dog pulls, and they need to do that because of the way that there are a number of dogs. It's the season when females are coming into heat. And so things get a little bit more dangerous around this time of year with the dogs that are roaming. So getting dogs out of the community is really important. And also, there are some ways that this can negatively affect individuals in the community and also, fuel those community tensions. So as far as actions and outcomes, certainly we've had, I think that the whole process of doing the research project has really resulted in quite a bit of action, right? There are little things that have happened as we've gone along, which has been really lovely. So for myself, I've been involved in a few different working groups, both at the provincial level and at the federal level, around dogs in Northern and Indigenous communities, because again, this is a problem outside of Saskatchewan as well, all across Canada. So doing some of those things, we've had our gorgeous art project, our art gallery that was produced as part of the research, and that's going to be going on tour for a couple of years, starting in January of 2024. So the Organization of Saskatchewan Arts Councils is taking that show on the road, and there will be lots of information there for people to engage with the research project. So understanding the art as a piece of the project and a way to relay the findings. And then we've done a number of presentations to veterinary audiences, to other folks. There have been news stories. And then we've got a really exciting pilot project that's coming up as well that's going to allow us to explore having a vet tech, a licensed veterinary technologist, provide preventive care services, so things like vaccines and checkups, whatnot, in communities that have currently no access to veterinary care, and start, try to creatively think about what are some different ways that animal health care could be delivered and who can do that, so that we can improve communities' access to care for dogs and other companion animals. So that's what we've done thus far. And so I would love to hear from folks what your thoughts are, what your questions are about the project. I realized that I just yapped pretty consistently for half an hour. And so, now's a time for us to talk. And if there are further concerns that you didn't hear me talk about, we'd like to hear those too. So I'm going to take a couple of notes also. If anybody has any thoughts, please feel free.
Question: when did you start doing this research?
Yeah, so we started doing data collection in 2019. So we got rolling as a team in 2018, around September-ish. And then it took us a little while to get the grant funding and things like that. And then once we had that, we got started. So it would have been, I guess, May or June of 2019 was when we started doing our data collection, right? So yeah, we've been working at it for darn near 5 years. So.
And I heard earlier, is that longer than it took to get your vet?
It is longer than it took for me to get my veterinary degree. Yeah. So my vet degree was 4 years, and it'll be 5.5 by the time I graduate. So yeah, it's been a lengthy process, but a very valuable one. And I was saying this morning that it hasn't really felt like work. It's been fun and rewarding. And, I feel like I've really gotten a lot out of it. And I think as a team, we've really developed some important relationships and things like that too. So yeah, it's great.
Yes.
Thank you. Don't be intimidated, like for real. This is like super, super chill. So any questions, any comments are more than welcome.
You were here from the beginning, so what kind of project is it? Can you tell us in short?
Okay, so this has been a community-driven, community-based research project trying to answer some questions about the challenges that people see with dogs in the tri communities, so that we could sort out what were the best things to do next, what were the best actions to take, the best steps to take that would start to solve some of those issues. So, and I'm a veterinarian, so I've been here running the clinics for, the last, I don't know, how long? 9 years, 10 years. So I had some knowledge about the community, but again, like I said, I sure learned a lot with this, a lot of stuff I didn't know. So.
In your opinion, what would be some setbacks or reasons why not only our community have trouble in getting vets or the vet techs, and in what ways could communities support bringing them into communities more than what we have?
Yes, that's a fabulous question. So there are a lot of barriers, I would say. One of them is certainly the way that we think about veterinary practice is that it is a fee-for-service endeavor. So you come to me, I care for the animal, you pay me, you leave, right? That doesn't always work in every community. Not everybody can access that care. And one of the things, like I remember when I was in veterinary school, one of the things that we heard from a business person was, you need 10,000 paying clients in order to appropriately support one veterinarian practice. So if we think about the tri-communities as an area that's around that 10,000 number, where not everyone would be able to pay out of pocket, right there is a challenge in and of itself, right? There aren't a lot of pieces of our training programs for veterinary professionals that encourage rural and remote practice. And I think, we've been trying to change that with the clinics that we bring up here. And, lots of vet students come, lots of tech students come. People discover that, the North is a great place. But there's a lot of, as you guys know, there's a lot of stigma about the North, right? People have these ideas about what Northern communities are like, and think that they're going to come here and see a bunch of dogs that are not well cared for, and not that there aren't really important dog-human relationships, and obviously they always find the opposite. But when people have those biases, they're less likely to end up practicing in an unfamiliar scenario, right? An unfamiliar environment. So, we've been trying to work to give students exposure to Northern communities, to sort of understand where some of the barriers are and what kind of responsibilities and also power they might have to change that. But I think we also have to change our minds as a profession a little bit around who gets to provide care, because right now our legislation is a pretty darn big barrier. And it makes sense to me that only veterinarians should do things like spaying and neutering, right? Like that should be a veterinary procedure. But there are a lot of things that could be done by veterinary technologists, and or by non-veterinary professionals. And so that's what we're trying to explore a little bit right now with this pilot project that I mentioned. How do we expand the scope of practice for veterinary technologists and also make that a career path that is visible and, looks attainable for people growing up in the North also? Because I think that what I would love to see eventually is a situation where kids know that a vet tech is a thing, right? Know that that's a career, see themselves potentially in that career, and then have local job opportunities so that they don't have to leave their home communities. And I think that would be a really ideal outcome, similarly to the model that human health has taken with nursing, right? Where people can do part of their education at home and then work at home afterwards. I think that's what we need to do for animal health as well. Now, of course, we have the added challenge of veterinary medicine not being publicly funded. And so there are gaps there. But I do think that there's a significant role for community care models to come into play where there's collective responsibility for supporting animal health care. We were talking earlier today about the more that we can frame this as a community health issue, the more that funds will be available. Because when there's an understanding that animal health is community health, specifically companion animal health is community health, governments or people who write checks in general are far more likely to provide financial support when at the end of the day, we're talking about human health, right? So I don't know I hope that answers your question, Julie.
No, and just sort of in a spin-off to that, what is the possibility of Northlands College per se ever having the vet tech program? So, in the different northern-based locations so that, like you said, it's something that's local and it's keeping people and it's meeting all those different needs.
So, and I think that there's a couple things that would need to be implemented there. So first off, right now, the only vet tech training program in Saskatchewan is in Saskatoon at Sask Poly. And up until 2 years ago, that was 2 years of in-person training, right? You had to be physically in Saskatoon for those entire 2 years. At the end of the 2 years, you're a licensed vet tech, but you can only practice in a standalone hospital, right? You have to be under the direct supervision of a veterinarian. And so that means that vet techs are only going to communities where there's a pre-existing clinic, right? They're not going to any other community because they can't. And right now, the way our legislation is written, vet techs can do a lot of things, but they have to be under the supervision of a veterinarian. Now, what that supervision looks like is the question that we're currently trying to sort out from a regulatory standpoint. But I think, now we're kind of edging in a productive direction where SAS Poly has changed things so that students can take the first half, at least, if not first 3/4 of the vet tech program remotely, so online. And then they have to be in Saskatoon for a portion, if not all of their final year. And part of that is practicum. So they have to be in vet clinics doing work under the supervision of licensed techs and vets. I think if that route was to be possible, and there is some work happening in terms of that. Brett Hagen did a survey with northern communities recently to find out about, what's the interest like in communities. And I think right now it's not super hot, but much of that is because people don't even know that a vet tech is a thing. As I said, right? We still go to lots of communities where kids don't know what a veterinarian is, what a veterinarian does, and certainly don't know that there might be another type of animal healthcare professional, that we would call a vet tech. So that's a gap that we need to fill for sure. And so I think that there's definitely a possibility of going that route. I think the biggest ticket would be, how is the practicum aspect of that program managed, and where can those folks work once they're done, and what does the oversight look like, all of that sort of stuff, the financial aspects of the practice, whatever. So I think it's possible. That's what I would love to see. And it's just a question of how do we get there, because there's the regulatory aspect, but there's also the sort of strategic aspect as far as the education provision, and then there's the awareness piece as well. So
Jordan, I'm just reminded during some of the points that you raised that there are so many parallels with human.
Absolutely, yeah.
And so, as a as a healthcare consumer and a former healthcare provider, we are hearing stories more and more about how difficult it is to find a family physician, and that's true even in larger centers now, right? People are opting out of that sort of channel of working in medicine because of many, many reasons. And so I'm just wondering how veterinarians might tie into some of those discussions around human health to come up with a service delivery model that isn't so dependent on the professionals being the front line and the gatekeepers of service. Because I think there's a room for midwives and nurse practitioners and vet techs. And, I think now, especially with the technology that we have, it's much easier to, in real time, be communicating or under the guidance of a professional when you're delivering supports and services, whether it's veterinary or human medicine.
Absolutely. And so again, I think that the telehealth, telemedicine piece is a really important aspect of this, and definitely with the vet tech pilot program that we're working on, that will be a part of it, right? So what it will look like is we'll have a licensed and trained vet tech who's experienced, who's in the communities, and then I will be talking to them remotely so that I'm providing the oversight, and then they will do the things, right? Because the techs cannot diagnose, prescribe, do those things, determine a course of treatment, but they can provide the treatment under the direction of the veterinarian based on the assessment. So now if I have a vet tech being my eyes, ears, and, and hands, I get a heck of a lot of information that allows me to then do the work of a veterinarian and do the diagnosis and prescribe and determine a course of treatment. So absolutely telehealth and telemedicine are an important piece. I think the other aspect when it comes to preventive care is, we all know that pharmacists give vaccines, for example. We need to do a better job of incorporating other people to provide preventive health care, because if we're thinking particularly rabies for sure, but there are other vaccine preventable diseases in animals that from a population health standpoint, doesn't cross over to humans, but from an animal population health standpoint are very important. And it's not hard to give a vaccine, right? Like it's really not a difficult skill. So we have to figure out what's the safest and most ethical way to provide that care in the absence of a veterinarian. Because just saying no one else can do it is ridiculous, because what it means is that then animals just don't get the care they need. And that's inappropriate, right? And from my perspective, and I'm probably still in the minority in my profession, but I very much feel that is an issue of ethics. So if we are consciously continuing to put up barriers so that animals cannot get what they need, we are choosing to create a situation where animals are unwell and where their welfare is challenged on an ongoing basis. And that's honestly in contravention of our code of ethics. So to me, that's one of the, when I try and talk to my colleagues about this, that's the way that I say it. And, hopefully there will be changes. I think we're incrementally getting there, and it's just a matter of how hard we push the policymakers, right, to get where we need to be. But
Thanks.
For this model that you're talking about, is the idea that the people accessing this service will be able to do that in an affordable way, or in a different way than, say, like going to the vet clinic in the city or whatever, where you do have to pay quite a bit? Like, is it going to be a different model, like that would be actually more accessible to people?
Yeah, and that's still to be determined with whichever the communities are that end up partnering with us on this pilot. But yes, that's the hope, right? Because ultimately the goal is to make it accessible, and it's really not expensive to give a vaccine. Like, vaccines don't cost a lot of money. And it's oftentimes the thing that costs the most is the professional service time. And so, the reality is that it's less expensive to pay a vet tech to do that work than to pay a veterinarian to do that work. And in Manitoba, there are certainly clinics that are taking on this model. I have colleagues I can't remember which community, it's not in Winnipeg, might be in Brandon. And they have a huge practice with 10 or 12 veterinarians. And most of their wellness appointments for cats and dogs never see a veterinarian. They only see a tech. And what that means is that it's far less expensive, because then you're not paying me $95 an hour. You're paying a tech $50 an hour, or whatever it happens to be. I don't know the actual price. And then you're still getting high quality care, the exact same care that you would get with a veterinarian, because that tech doesn't need to diagnose anything, right? They're there, the animal's there for a wellness check. They're there to ensure that there's nothing abnormal. If there is, then the veterinarian gets called in, or they get booked for another appointment, right? So I think for this model, what we will propose to communities is, how would you like to fund this? What's the most acceptable way to do this from your community's perspective? And some communities may say, we've got money, we're just going to pay for it out of the community budget, right? Some communities may say, we'll do a copay with our residents, right? They pay X number of dollars, we'll pay the rest, or whatever it happens to be, right? So I think that there's always room to customize that stuff. But absolutely, at the end of the day, the most important piece is to make it accessible. And I think that's, for me, the most important across the board, right? And when we started doing the clinics here, that was what I said, is I don't want to go and do this if it's not going to be accessible to everybody, because then what's the point, right? So, and I think here, I think we've done, some pretty cool things in terms of having a disparate model, right? A varied model, so that people can access the care regardless of whether they've got the funds themselves. So,
and one more question sort of relating to that is just I think the vaccines are obviously extremely important. We do see a lot of challenges with regards to packing and going after females in heat. And I'm wondering about alternatives to a surgery that a vet tech could oversee, so that we have access to some form of sterilization, so that we don't, we have this healthier population, but then we if we don't have a regular access to the spaying and neutering, that, kind of poses a challenge because, the female in heat, that's where a lot of the packing up happens and, some of the dangers to the community members. So I'm just kind of wondering about that. Like if they can't do surgeries, is there an alternative? And I have heard rumblings about like a pill or injection or whatever it is to sterilize females. Like, is that something?
For sure. So as my watch falls off. In Canada right now, we don't have anything licensed for chemical sterilization. However, there are products that are out there that are used in other places in the world. So Australia has been a pretty big sort of driver of the chemical sterilization research. There's quite a bit of research in the States as well. And there are products that are both for males and for females. And they're great because there's one product for males that's actually permanent. So it's an injection into the testicles and it stops sperm production. There needs to be some training for the individual who does the injections, but it's definitely far less resource intensive than doing surgery because you don't need to anesthetize them. You don't have a big incision afterwards. You don't have to have those specialized skills. So that's certainly one thing that's very attractive to me as a healthcare provider. For females, there are various things. There are injections. There are also implants. None of them currently are permanent, so they all have to be redone every 6 to 12 months. And again, none of these things are available licensed in Canada. So right now, what that would mean is that there would have to be an application for an emergency drug release, they're called. So if you're wanting to access a product that isn't currently licensed by Health Canada, then you have to write an application and have a justification for why you need it anyway. I think that what would be great and what would be really fun and what I would love to do is I would love to do a research project and have a pilot community where we do a bunch of chemical sterilizations and, sort of talk to community members and measure dog health, behavioral health, especially before and afterwards, and illustrate the value of doing this. Because, yeah, absolutely, it's pretty resource intensive to bring. Like when we come here, we bring 50 to 100 volunteers. We spend 4 days in the community. We set up. We've got the whole arena. We've got all of our oxygen tanks and all the anesthetic machines and everything, and it's crazy. So, I mean, luckily we can get here by road. But as soon as we're talking about, like, I've had phone calls from Uranium City, Wollaston, Stoney, how the heck am I getting all that stuff up there? I'm not, is what's going to happen, right? But could I fly there with a suitcase full of syringes and implants? 100% I could, right? With 3 students and a tech, for sure. So I think that when we start to explore what the alternatives are, it opens up a whole lot more doors. And so that's, like I was saying this morning, I don't see us being done with this, right? Like that this isn't the end of what we want to do with this stuff in the tri communities or, for province wide in general. But this gives us kind of a springboard for whatever is next. And I think that that's a potential option for sure. We'd also talked this morning about, if there were a space in the tri communities where there could be a surgery suite set up, it would be far easier for me to send a vet, a tech, and 4 vet students up once a month to spend a week in the community and blast through a whole bunch of surgeries, right? That would be a very easy thing to do if there were a facility available for it. So, sky's the limit as far as I'm concerned. I don't think that there's really much that can't be done. I think it's a matter of, what makes the most sense in this region, particularly. And then, for other places, what are the other potential options,
So I am both a dog caregiver, parent. I am a community member. I am a politician. Kind of a 2-pronged question. What's the most important thing that I can do? You've heard so many stories and been able to synthesize
kind of some messaging behind that. So as a community member, what's the most important thing that I can be doing, either as a dog parent or just friendly neighbor or community member, to advance the relationship among community members and the animals as I go forward? And then also as a politician, how do I advance?
Yeah, that's a great question. So I think as community members, as neighbors, as, you know, folks who live here, one of the most important considerations, I think, is how can we help each other sustain our relationships with dogs? Because what doesn't seem to work is having a system where people are penalized for X, Y, or Z when it comes to the ways in which they care for their dogs. And of course, there are some situations where there needs to be a disruption of that bond, right? If animals are being, you know, grievously abused or neglected, absolutely there needs to be enforcement there. But very often the things that come up as concerns with dogs in the community are very frequently related to a lack of access to resources of some kind. And so I think if, you know, like I was saying this morning, figuring out what is the priority here? What's the goal? If the goal is to have a healthy community where dogs and people get to live together well, and also that everybody should be able to benefit from that beautiful interspecies relationship, then what's the best way and the most sustainable way to, as community members, support that? And I think right now NAR is doing some really good things when it comes to trying to help people remain with their animals if they're experiencing you know, gaps in their ability to access, whether it's food or, you know, straw for bedding or whatever it happens to be. You know, I think that type of community care model is the dream. So contributing in that way, whether it's supporting NAR or, you know, whatever the ultimate tri-community model ends up being, and then also just like being a good neighbor. And if you see something that concerns you with a dog, sometimes just asking the person, hey, I noticed this. I wonder if there's a way that I can help you, if you're equipped to do that, right? Or, hey, I'm noticing this. I wonder if it would be helpful for us to call blah. You know, and doing those things in a collaborative way. Because again, we heard so much about the interpersonal tensions, the community tensions that happen with dogs, that I think the more that we can think about this from a relational perspective, so how do we preserve not only the dog-human relationship, but also the relationships between people in the communities and in neighborhoods, is ideal. So that's answer number one. And I think answer number two, you know, we talked a lot this morning about bylaw changes, right? Dreaming up bylaws that are realistic, that have elements to them that are applicable within the sociocultural, you know, socioeconomic status and context of the community. Again, with what is the goal in mind? Is the goal to have people be able to stay with their animals? Okay, then how do we reflect that in our legislation and our policy? And then also, you know, like we were talking about earlier, remembering that the stuff with dogs is really a community health issue. So as much as it often feels like, okay, that's dogs, that goes to the bottom of the list of priorities because this other thing over here is much more important and emergent. Remembering that when this doesn't get taken care of, it's going to continue rearing its ugly head, and it will continue to influence some of these other bigger problems over here and be influenced by them as well. But, you know, everything is so interconnected that if we can start to tease apart some of those interconnections, or maybe not tease them apart, but to kind of strengthen this piece over here, oftentimes those ripple effects are felt in other places. So yeah, identifying what are the priorities and what can collaborations look like, you know, between the community leadership structures.
I got one. Okay, it's kind of two-part.
Love these two parts.
Yeah. So with the tri-communities being like three, tripartite or whatever, it's a little bit complicated, right? Does that also represent an opportunity to, if we can make it work, export this model? Because it's not just here where these, like, my sister lives in Buffalo Narrows and the dog problem's arguably a lot worse. So is the interjurisdictional difficulty also an opportunity? And then the second part, we lost a dog, my family, in pandemic, and we couldn't euthanize her. So she died in our arms. It was tough, but it was all right. But we can always try to do better. And can a vet tech euthanize in any situation through? And yeah, that's the two.
Yeah, and so a really okay. So the first question about having a regional approach and whether that model is sort of transferable to other places, certainly it is. So we also provide services in Isle La Crosse, and of course, there's a group of communities over there in the Northwest, and there are similar challenges with working between community leadership structures. Sometimes different priorities, sometimes different cultural contexts, things like that. And so I think that, yes, I'm an outsider. What happens here, it has the potential to really inform what other regions might be capable of doing as well. Because, and what I said this morning is that if, like, whatever it is that happens, it should really be recorded, right? The process should be recorded, because that's how we can best say to other folks, right? So this is what worked for us. This is what was not so good. So here's what we'd recommend if you're going to do the same thing. And I think that can be really valuable, because why reinvent the wheel, right? If there's something that's tried here and it goes great, or elements of it go great and others are a huge challenge, then let's share that information. I think that there's huge value in that. And beyond Saskatchewan, like I'm telling you, this is a phenomenon that is not only nationwide across North America. Every country that has a similar colonial history to Canada has the same picture when it comes to dogs and dog care and control in communities, and the same disparity between access to care. So I think that, there's lots of opportunity for international information sharing as well, and that's exciting. Like, to me, that's a really exciting thing. As far as euthanasia goes, one of the things that we did about 5-6 years ago is we had a group of folks come down from the Northwest Territories to do a euthanasia course with us. And so it was a veterinarian, and there's only a handful of vets in the Northwest Territories, and she's in Yellowknife. And then it was a couple of conservation officers, and then 2 folks who work for a rescue organization. And their legislation is far different. In the NWT, they have a lot less legislation. Anybody can go and be a vet there as long as they're licensed somewhere else. So things are kind of wide open. But in terms of who can perform a euthanasia, it kind of depends on how that's done, right? So there are certain, like the drugs that I would use to euthanize a dog, not just anybody can use because it's a controlled medication. But how can that be done? Could we expand our understanding of who's allowed to access that drug and do that procedure? Absolutely, we could. There are models for that elsewhere. And so we've certainly talked about, like, could we train, there's a local individual who's a nurse, could we train that person to do euthanasia, right? I also actually have no problem with dogs being shot if it's done well, right? So that's a perfectly reasonable way to euthanize a dog if it's done in a way that produces instant death. So I think that, again, that's one of the gaps that we heard a lot about, and we do need to have a system where people can access end of life care so that we can prevent suffering. And it doesn't have to be just a veterinarian. Certainly a vet tech absolutely could use those controlled drugs if they were available. And there are many, many, many other ways that animals can be euthanized that could improve accessibility. So it's just a matter of, how do we set that up? How do we provide the training? How do we provide the equipment? And then the aftercare as well. Because again, the drugs that I use to euthanize an animal, you can't bury them, for example, unless they're going to go 6 feet deep, which in the field is not possible. So There's lots of, little details there that have to be thought of, but absolutely. Yeah, good question. What other questions or thoughts do folks have? I have one for you all. If you were to kind of come up with, what did we miss? Like, what did we miss in what I've told you that you think is really important when it comes to issues with dogs in the tri communities? What else should we have looked at or asked or found out? Yeah.
So you said this morning that you spoke with the tri-community leadership.
Yeah.
And within your research, you have identified that there are public notices, the conflicting bylaws. Does leadership also acknowledge those?
So I will tell you that during the... So this morning we had a meeting with the community leadership. So the chief and both mayors were there. Abby was there as a counselor from Ronge. Annie was there as a counselor from the band. We had the administrator for the village. We had the RCMP sergeant. Lisa was there. I think definitely. So I will tell you that during the key informant interviews, absolutely, there's acknowledgement that there are some conflicts between the bylaws, and also that there are challenges with the bylaws being so different across the board. Then there are also challenges with how those bylaws get implemented, right, and enforced. And so as I mentioned already, there's I know that there are changes happening with regards to the dog control bylaws of, for sure, Ronge and the band. I don't know, Julie, if you guys have started anything yet, but I know you had talked about it a while back. So there's for sure recognition of that it's not necessarily working. And I think one of the gaps previously was, okay, but how do we, what needs to change? And so I think that one of the things that has been helpful with this is at least being able to identify some of the things that might be worthwhile changing.
So in that conversation, ideally it's a thought that they'll come up with a common ground for all of it. But was there a feeling this morning of where that common ground would grow from, or what was working and what wasn't?
So we ran out of time. But what I will say is that Abby and Julie, you guys can hop in if you want, but there was definitely a pretty significant feeling of momentum, and that leadership from all three communities were pretty excited about the idea of working together on something, whatever that might look like. But I think there's lots of willingness and interest right now, which is really great. Yeah, of course.
And it's also, just to keep in perspective, we as leadership and only just a few members of each of the three leaderships were at the meeting this morning where we were presented the data. So we ourselves haven't even had an opportunity to go back to our own collective councils and staff to discuss the findings, discuss these meetings, share and kind of see even where we individually know that we have to do things before it even gets regionally. Like, we each have our own areas that we need to discuss and figure out before it can get. So this, I'm not trying to be a Debbie Downer, but it's very premature, I think, for us to say yes or no, or maybe we just got this information this morning at noon.
And there's that complexity piece, and as you say, all the steps within each community leadership structure to kind of.
Yeah, I kind of almost envisioned a little bit of that process that you described, where the councils and ourselves, NAR, would go back and sort of have a look at the picture and recognize what strengths that we each have. What are the challenges that we're experiencing in the community? And then at some point that it would come back together, and then you kind of sort of overlay
those pictures together to see like what is working where, what are the gaps, and how are we trying to fill those, and sort of getting the bigger picture, right? Like, because there's these like individual things that are happening, but then that's all part of a bigger picture. And we kind of have a bit of a sense of like what would be like a comprehensive approach, I guess, like to this issue. And so there's like elements that maybe none of us will ever be able to achieve. And then there's elements that maybe one is doing really well and then another is struggling, but that one has this strength that the others don't. And so like, I think it would be like a process, right? Like to going through some of that individually, but then coming together and having those conversations afterwards. Like, I don't know if that resonates or not, but yeah, like.
Yeah, it's just a matter of that identifying that for all three and it is a priority, right? And
yeah.
Go from there in terms of what's okay and not what's up. So, yeah. Anything else that we missed?
No, I was thinking, as you were speaking, I was thinking of all those things and then you said it. So I don't know. I do think one of the things with this project, the project itself was super cool because like we did the data collection like a lot of research, but then it was translated into artwork. And so like that is one of the really neat things about this research project and how it highlighted the relationships between people and dogs here. And so it made it more accessible. Plus it also added even more layers of depth to it because it was depicted as artwork from local people. And so that was something that is getting a lot of attention, it seems like, in circles that you're part of, is how unique and innovative it was, like the approaches that this research project took. So I think that's such an awesome thing because not only will it result in potentially more changes within our community, but it also might change how research is conducted with communities in a larger scale, and in particular with Indigenous communities, and how that information is translated and represented. So that's something that I think is a huge strength of the project also, and super cool. And I would agree about the youth.
Healthy dogs, healthy community.
We didn't really talk in depth about that part of it, but their voices were so profound and so powerful, and just really more about that core of our model that you saw. And it was very much about, that relationship, that bond. And they didn't even really have that concept yet about all of these systemic issues that all of us are so wound up in. And they were just so pure about their love and relationships with dogs. And that is very inspiring, for me anyways.
Yeah, the reading the youth journals was like the most fun ever. It was because it was funny, and it was heartbreaking, and it was touching, and it was all of the things, and youth are just so good at hi Leroy at really verbalizing that importance of that relationship, which is lovely. Oftentimes they do it a heck of a lot better than adults do because we get in our own way. I think the other thing that's neat with this project is this isn't a type of research that's done often in veterinary medicine. And so I'm definitely the weird kid on the block when when I'm talking about research in my academic life, because a lot of my colleagues don't understand how this is research because they are very accustomed to numbers, right? Numbers are the only thing that mean anything. And so having all of these different ways to communicate how valid and valuable stories are, I think is really fun and exciting. And again, being able to use things like artwork, which by the way, was not my idea. That was Genevieve's idea, right? This is part of the thing about collaborative research is that multiple people's creativity get to come to the table. And that's why it ends up being cool, is because It's not just one, one brain working on the problem. So it makes it really, first of all, it's super fun. And then also I think that the outcomes are far more valuable at the end of the day too.
And probably like the strengthening of the relationships amongst the communities and like the folks that were involved. Like there's just been so many kind of neat like outcomes from that, and new friendships formed and just relationships amongst people. So that's been a really maybe unexpected outcome, like from the research also. So
yeah, and in the academic piece of stuff that I've done for this, which is like a 500-page book, one of the things that throughout it is relationships. Relationships are the most important thing at the end of the day, right? That's what drives all of this, whether it's relationships between dogs and people, between dogs themselves, between people and people, within and outside the tri communities. All of us on the research team, I agree. I think that that's been the most fundamental thing out of this entire project is relationships, and how we're accountable to one another within those relationships too.
I know I'm coming from a biased position because I'm Jordan's mom. But I think for me, because in my professional life, I also did community-based work. And I think that one of the things that this work has honored so delightfully is how we learn and share together in many, many different ways. So that coming together, it's not just the academics, the people that have a title or degrees behind their name that are put on a pedestal. It comes much more from a place of humility and a desire to be learners and teachers together. And I think that's really a critical piece of any community research. So good for you. And I don't mean you personally, I mean everybody, right? And then the other thing that I wanted to say is I also worked on a component of this project because I was the cook. And
damn good one too.
And so it was really important to me that when we were providing this service, we didn't look at people coming through the door and who could have food and who couldn't, right? I mean, if a hungry individual from this community came in and we had food to offer, they sat down and we fed them, right? And I can't tell you how many times I had people coming in at 6 o'clock in the morning who had probably been partying all night, and all they really wanted was a warm place to sit and a cup of coffee. And so we made sure that that was part of it. And I think that's another piece of community work that gets overlooked, right? Is that every facet of whatever you're doing has to embrace that model of if we've got something and you don't, we're here to share it with you, and vice versa, right? Whatever that might be. So I think that's been a really important piece as well.
Yeah, and I think that community care aspect with the dogs too, right? So, that really becomes very important. And I think, yeah, a big part of what we heard loud and clear with this project for sure. Mm-hmm.
Because you have done an incredible amount for our communities and our people and the animals. And I know you're too humble to ever admit that, but you have been the driving force of a lot of this. So thank you.
Double doctor. Double doctor.
Thanks, everybody.
I have a question for Mayor Baschuk or Councillor Bashara. Like, is there anything that came about from the pandemic in terms of it, like the 3 different councils coming together? Is there a committee or something that could carry that inertia towards a regional animal welfare movement?
There isn't one in existence necessarily. Town of Ronge has been, we're always open to regional conversations, tri and quad community. There's a lot of really great people to work with in this region that we all share a lot of problems, and there's a lot of examples of existing relationships as a tri-community, quad community, greater region of working together and finding solutions to things like fire protection and water and so on and so forth, regional waste management. So there's models that exist within our own context, and in the conversation today with leadership, it's one of the hardest things to do is to prioritize, to figure out, you've got fires burning all over the place. So oftentimes the animal control, animal relationships, and that particular bylaw requirement that we impose gets kind of put on the back burner. Myself, I've advocated at my council table for a little more attention to be paid, a little bit of allocation of resources. Ronge is really proud of the relationship that we built with NAR in finding a new way to do animal control, and that's evolved and it's growing and it's evolving, and happily paving the way that maybe more partners can get involved with that. The town being one of the bigger municipalities in the region, we tend to have to take a bit more of a leadership step in that direction. We're currently reviewing our animal control bylaw, which I hope can be looked at in a greater regional context and its effect on neighbors and how we can do better for the fact that dogs, cats, they don't respect our municipal jurisdictions. So
And they don't pay taxes.
but we all love them and we all look out for them as a community, and it's kind of funny. I see the efforts that each community goes to contribute to the animal care in this community. So I don't think it's not necessarily laid out before us, but there's a path we're walking together that leads towards that. And I think your research is going to be a really great catalyst for advancing that conversation and maybe allowing us a bit more prioritization of that conversation.
Cool. Thanks. Julie, is there?
I love the last part of that about it gives us sort of that platform to get those conversations and get that discussion rolling on where do we go. So I think it's easy, we get stuck sometimes on, okay, we're meeting certain needs that municipalities have. We know you could always do better, but what does that look like? What are the true needs? And I think you've laid it out beautifully and really have provided us with with the recommendations and the direction that I think would benefit the tri-communities.
Cool, thanks.
So I don't have a question, but I have a comment either for NAR or councils. But is there a position that could be held for a youth advisory on your boards? Because from what I'm hearing, you had a very profound perspective from the youth. And so as you're bringing up the new generations, having youth advisory on your boards may give that other extra edge that maybe what you have at your tables already is missing.
It's a cool idea.
Yeah, we don't currently have a position on the NAR table for that, but it is, definitely I would agree, and I think we would all agree that that's who our future is, right? And our future leaders, and their voice is really powerful if we listen, to them. A lot of the times, the things that are so complex to us are so simple to them. It's how do we get to this vision that they have? Because a lot of them, and it starts in pre-K and kindergarten, who, I spend a lot of time with on behalf of NAR, is those little ones. And even them, even they are brilliant little thinkers about what the issues are and what potential solutions are. So
I mean, I agree with that. I think that's a great idea. And whether it's a position or if it's like if it's a shared thing, like I'm not sure what that would look like, but it's something to really explore. Yeah.
Involving your
Yes.
will get, the youth in this community wanting to be more proud, and that builds relationships with the tri-communities too. Because it's not just relationship building through sport, it's relationship building at a different level.
Yeah.
And like you can access your school leadership councils to see if someone would want to sit on whatever board.
Yeah, no, and our council, we have recognized and discussed that. And when we had recently done our strategic plan, we made sure that Gordon Denny students and Churchill students were a part of that process and had a voice in defining what our community vision and plan looked like moving forward for a course of 5 years. Also within the Northern Municipalities Act, it is in legislation that councils can have an elected youth advisor sit around the table. So that is something we haven't actually proceeded with, but we've had many discussions about going to the high schools, having that and seeing if we can get, the engagement, if it's a rotational. We know it's tough sometimes to get youth in, but I think our council's definitely recognized that they do have a voice and a voice that needs to be heard.
And if I could add to that as well, I think perhaps the reason it hasn't happened yet is because the pandemic slowed our efforts.
Everything down.
But those engagements that we've just spoken about have taken place following all of that and have started that process towards building those relationships and being able to go and find a youth or more to represent. So,
but knowing the limited capacity, the wholeheartedness with which our volunteers exist and run the boards, it's not an outstanding effort, but it is an effort to try and support a youth to participate. And that right there is its own challenge, is that we don't have enough resources in the human side of things to blue sky. Everybody would want to have youth advisors because they are the ones that are going to be inheriting all the decisions that we make as politicians. I know with the NAR board, when I can, I try to help. The dedication of that board blows me away. And every day I feel honored that they exist and they continue with their work, because it is thankless and it is heartbreaking and it is so necessary. So ways that I can work within my context to continue to support that. Maybe that's looking for ways that we can involve more youth together as groups in a more regional context, in having a youth council that is supported by more than just one particular board, one entity focusing the energy on that, and finding a little bit more of a collaborative approach, because I can't speak for my whole council, but I'm pretty sure that there isn't anybody that would reject that idea, because it is important. And I have to say, I'm pretty happy with the age range on this council that we have at town. It's diverse and representative. So we at least have that.
Well, it's even the definition of youth. Because you could say, oh, it must be a high school student. But honestly, in terms of the government, 35 and under.
39 and under in some organizations.
Whoa, there we
I'm
go.
a youth.
Whew. But yeah, 35 and under is youth.
Yeah.
So like, even if you grasp those, 18-year-olds or emerging adults.
Finding ways to mentor them into roles that they can participate in. And that's,
talk to your community services manager about that.
Any other thoughts folks have? I don't want to cut anybody short, and I'm also, what time are we at? We're at like 20 to 8 already. Well, I appreciate everybody coming and spending this time with us. It means a lot to me. I think so. I have to do something like this on the academic side in a couple of months, and I was really happy that we could get here and talk to you all first, because the most important thing is that this is useful and valuable to the community. At the end of the day, you know, if the people in the university like it or don't, I mean, whatever. but if it serves some purposes here for you all and for changing some things moving forward, that's what we wanted in the first place. So I really appreciate everybody's feedback and listening. And I have, all the time in the world to talk about these things at any time tonight. Still, there's lots of cookies. I hope people have a grab, coffee, water, cookies, whatever before you go. But certainly people are more than welcome to reach out to me or the team at any time. And I'm more than happy to chat about all the things dog health related. So thank you very, very, very much. Thank you. You're gonna be back. I will be back. Yeah, we'll be back in May and again in August, but I'll be here in between that also. So yeah, lots more chances to talk more and do more things. Absolutely.